Welcome back to Talk 1260 KTRC, the humanity behind the vanity. This is Dr. Daniel Rennell. We're talking about the realities behind plastic surgery, and we're doing listener emails.
We just finished talking about fillers versus Botox,
right,
or a combination of the two, which is a very, very common question. I just want to ask one last question about that.
Yeah.
Women in certain age groups, you know, if you've been making the same expression for decades longer,
right,
are they more prone to getting filler, or will Botox eradicate it regardless of age? It just depends on your skin.
They're more prone to requiring a filler because their wrinkles are starting to get permanent.
Right. Okay.
Yes,
Just curious.
right.
Okay, good. All right, here's the next question. I'm wondering if surgery is a solution for my situation. On my lower lip, there is what appears to be a hard and dark growth. I imagine it's like a blood clot or something. I'd like to explore the options for having it removed. Interesting. That's a unique question.
Right, and it raises the specter of skin cancer because there are two general types of skin cancer, melanoma and non-melanoma. And we make that distinction because melanoma is a killer. It's terrible, and it has to be considered. It's actually the cancer which causes the most loss of productive years of any other cancer because it can affect young people.
Yes.
And it's devastating. It's a killer. So anyway, but
evil.
The non-melanoma skin cancers are the ones that everybody sees, the basal cell carcinomas and the squamous cell carcinomas. And most of those occur in the head and neck. And one of the most common places for a squamous cell carcinoma to occur is on the lower lip. And so when I read that, that's the first thing that I thought of. And that's probably not what this person has. He may probably have a blood clot or a hemangioma, which is a little abnormality of the blood vessels, because you commonly see those in the lip. But that lesion needs to be excised. And the answer to that question is, what can you do? You have to cut it out. And actually, surgery on the lip can be pretty aesthetically hidden. The lip, especially the lower lip, is very forgiving, and you can do a certain type of wedge excision where it doesn't leave a bad scar at all. There's a scar if you look at it, but it's usually not a big deal. And we've talked about lips before. There are a couple elements, the white roll, which is right at the edge of the pink and the skin, and the red line, which is where the wet and the dry mucosa meets. Anyway, if you line those elements up when you put a lip back together, then it looks really good. And so what we have to do for that is to cut it out. And the thing about skin cancer, it's so prevalent here in New Mexico because the sun is so intense. And when people put on sunscreen, Marion has talked about this, they often forget their lips. And there are sunscreens for the lips that are really important because especially if you're a smoker, if you chew tobacco, then you're doubly at risk for getting an oral or a lip skin cancer. So you've got to really think of sun protection.
I don't. I mean, I'll be honest, I don't.
No, but we have to. Yeah, I know. I need to also. And for our kids, we should be putting it on their lips too.
You put it on your big bald head, but that's about it.
Right. A hat is good too. Thanks very much. So anyway, so that's the story with any kind of lesion, especially pigmented lesion on the face. It really has to be cut out and sent to the pathologist. And a dermatologist can often, or even a family doctor who's trained in some surgery, can cut out small ones that aren't in high-risk areas. But if you have a pigmented lesion or something that looks like a skin cancer on your nose or near your eye or near the corner of your mouth,
and an area you care about,
I would go see an ear, nose, and throat doctor or a plastic surgeon, or a facial right, because they're trained to excise them in such a way that won't leave a big scar. There's a type of surgery called Mohs surgery, M-O-H-S. And there are no Mohs surgeons in Santa Fe, unfortunately, and the ones in Albuquerque are extremely busy. But they're dermatologists who have been trained in facial, skin cancers and closing them aesthetically. And if you can get in to see one, then they're great. Dr. Connolly is the one that I use almost all the time.
And even if you're not a patient of Dr. Rennell's and you have a concern about this, you can always call his office and they'll happily refer you.
Right.
Absolutely.
Right. there are a couple great dermatologists in town in Santa Fe, and
Beth Jester.
Beth Jester is very good.
That's mine.
Dr. Auerbach,
Auerbach,
is
yes.
very good. And Norm Kazmarek, who's from New York too.
Oh.
They're hard to get into, but because they're so busy. And if anybody knows a dermatologist who wants to move to Santa Fe, please bring them.
Yeah, we need
I'll put them in
more
my
up
office.
here. Right, that's right.
So anyway, that's what I wanted to talk about with that one. Let's do, if you don't have any other questions, we can look at the other one.
Okay. Here, we'll go back to this one now. All right. Interested in getting my midsection and thighs done. Need to know how to go about it in the right way. I work out and I eat right, but still, I don't see any results. I want to feel better about my body and not sure where to go from here. I'd like to set up an informational appointment with you.
Okay, let's skip
Such
the
a common concern.
let's skip the midsection one just because we've talked about that so much. But just for thighs,
A lot of these people could go put a shingle out in Mexico and open their own abdominoplasty clinic.
yeah, that's true.
Sorry, in the border towns. Okay.
Just briefly about thighs, there's really two things to do. You can suck out fat with liposuction, or if you have too much skin, you have to excise it. And it's nice to hide the incision right in the groin, which is great, but that only rejuvenates really the upper third of the thigh. And if you've got a big thigh with a lot of loose skin, you've got to make an incision right down the middle of the thigh.
The middle? In the front?
No, right down the inside. The inside middle of the thigh.
Your inseam.
Right,
your inseam.
exactly where the inseam is.
Ladies, your inseam.
Right,
We know
and
what
yes,
that means.
yes, it's visible when you wear shorts. Eventually it'll fade. But people would rather trade a scar for, you know, the big extra skin and fat. So that's all I wanted to mention is the way you do thigh is, you know, usually a combination of liposuction and some surgery, and if you're lucky you can just get away with the surgery that's hidden in the groin.
There are problematic patients, though, for that. Not personality-wise. Physically, I mean, like I've asked you, would I need a thigh lift? And I know some other women that you have operated on who have showed me, look, I've had a thigh lift, but I don't notice that much of a difference.
Right.
There are more, so describe the anatomies that are more problematic and the ones that might be easier.
Very muscular thighs are difficult. Thighs with very loose skin are easy.
What about skinny thighs?
Yeah, skinny thighs are pretty easy, but muscular thighs or very overweight thighs, they're difficult. And it's all about teaching the patient what their expectations should be and what their improvements can be, and that's hard to do sometimes. Very often you can't do anything around the knee. A lot of people
That's everybody's issue, yeah.
It's really hard to do anything around the knee without leaving a big ugly scar right on the knee. But now we have to wrap things up. Our producer's telling us we're running out of time.
Get lost, Gino.
Okay,
All right.
listen, thanks for listening. Thanks to our sponsors, Geneva Medical, the makers of Artifil. New phone number, 988-8886.
All right, and then March coming up. We'll keep reminding you the next couple of weeks.
Vanity for Charity.
Come in.
Come in.
Deep discounts, fillers, Botox. All the money goes to this fabulous little school.
Right. Thanks for listening. We'll be back next week.
Yeah, a new time, 12:30 Saturdays. Catch you then.
Bye.